20. We generally work at the correct time, but it's a great pleasure to come to Jaffna Hospital. I thank Honorable Angajan Ramanathan and Honorable Dharmalingam Siddharthan having come forward here. And big thank to the doctor, the director and all the staff members of Jaffna General Hospital. As Secretary Dr. Palitha Mahipal highlighted, we also again acknowledge and appreciate and apprehend your services to the people of the Northern Province and the people of the Sri Lankan healthcare sector. So the policy direction is very clear on the long run. Whilst we are trying to strengthen the services at Jaffna Teaching Hospital and also the tertiary care units, our aim is to strengthen the primary health care on the long run. So a lot of assistance rather than coming to the tertiary care centers to reduce congestion. We have to work peripherally and work with the other institutions to ensure that we prevent and protect our patients at the ground level. Historically, we have done exceptionally well. That's why, as I mentioned, World Health Organization always recognizes and highlights Sri Lanka as one of the countries that provides better quality health care at low and affordable costs. And we have done exceptionally well in maternal care and also the child care. But the worrisome factor is, since our late, our universal health coverage has come down a little. It stays at 67%, even though we have done well in prevention, treatment, protection. Our palliative care and rehabilitative care segments are not functioning that well. Given the backdrop of one of the fastest aging populations in the world, Sri Lanka needs to look at our elderly population as well. So from 2025 onwards, whilst looking at the strengthening of the primary health care sector, we will also look at conditions which are related to non-communicable diseases. You can see number of cancer patients are going up. The patients with ischemic heart diseases, hypertension, diabetes and strokes are also going up. With that also not forgetting the fact that there's a significant number of patients after falls and road traffic accidents. All of them need rehabilitative care. So your section, we appreciate your services at the rehabilitative sector, but government also has taken a policy decision to ensure that we establish fully fledged units at each district covering rehabilitative sector. And also we have to ensure that we provide better care for our patients with cancers at the terminally ill patients. So the palliative care segment will also be looked after. So those are the main policy concerns of ours. But also at the same time, we always come across this request of rebuilding hospitals and also developing physical infrastructure, which is a need of the day. So whatever as we mentioned earlier, whatever the requirements that we will look into yours, and also given the backdrop of the financial situation of the country, we will surely look into your the teaching hospital and also the needs of the northern province as well. So take my word, that we have promised certain things from the next year's budget, that money would be forthcoming to ensure that most of the essential requirements of the Jaffna teaching hospitals that would be fulfilled.